The occipital bone is a bone of the cranium which forms the posterior and inferior portions of the skull, where it contacts the two parietal bones at the lambdoid sutures and the temporal bones primarily at the occipitomastoid sutures, where it contacts the mastoid portion of the temporal bone, which you can see here from several views. The occipital bone also forms part of the border of the jugular foramen with the temporal bone. So the jugular foramen is an opening which is bounded by two bones, the temporal bone and the occipital bone. And through this foramen, the jugular vein brings deoxygenated blood from the brain, and three cranial nerves, the glossopharyngeal, the vagus, and the accessory nerves pass. The occipital bone, specifically the basio-occipital portion, contacts the sphenoid bone, as you can see here in this image where the occipital is blue and the sphenoid is red. And this forms a joint known as a synchondrosis because of the presence of cartilage. It is not a suture. It is known as the spheno-occipital synchondrosis. Around the prominent opening, the foramen magnum, are two condyles, the occipital condyles. It is here that the vertebral column suspends the skull. The skull is not supported in any other region, and it is the movement of these occipital condyles with the first vertebra, the atlas, in its superior articular facets, which allow us to move our heads as we nod them yes. The foramen magnum, the big hole, is where the spinal cord enters the cranial cavity and enlarges to become the brain, specifically the first region of the brain, the medulla oblongata. And all of the fiber tracts which connect the brain and the spinal cord thus pass through this foramen magnum. The shape of the occipital bones accommodate the second largest portion of the brain, the cerebellum, which is in the inferior posterior part of the cranial cavity. It should be remembered that while we often focus on the great expansion of the cerebrum during, say, primate evolution, or the change in early hominids, given that the human cerebrum is, say, 3 times bigger than that of chimps, the cerebellum is also about 3 times bigger in humans compared to chimps. In fact, the growth of the cerebellum is a bit greater than the growth of the cerebrum in modern humans, and so this was certainly significant in our recent evolution. Also significant in our recent evolution is the position of this foramen magnum. If one were to consider a typical ape, so chimps, gorillas, orangutans, one would notice that the foramen magnum comes in at an angle. This then forces the spine to join the cranium at an angle and then encourages quadrupedal locomotion, so that these apes spend most of their time walking on both their legs and their arms, whereas one considers not only modern humans, but early hominids such as the Australopithecines. They are upright, not only because of adaptations of their hips, knees, ankles, and feet, etc., but also because the opening, the foramen magnum, is directly underneath the cranium, so that the spine is held vertically. Quadrupedal locomotion is no longer easy, and so it was the migration of this foramen magnum which was a major step in the upright walking of early hominids. There is a small channel, the hypoglossal canal, which exits the occipital bone in the vicinity of the foramen magnum, through which the 12th cranial nerve, the hypoglossal nerve, passes. The occipital bone is a composite bone. The one single mammalian bone is formed by the fusion of separate bony elements during fetal development. These separate bony elements represent the original occipital bones in the occipital region. When one considers reptiles or amphibians or fish, there are multiple bones, a basio-occipital, exo-occipitals, postparietals, tabulars, a whole set of bones in this region, which over evolution gradually fused. And in human embryos, one notices that there are a number of separate ossification centers corresponding to these ancestral bones, which then fuse to form the one single occipital bone. If one considers the lamboid suture, where the occipital bone meets the parietal bones, one often finds separate bones called Wormian bones or Incan bones or sutural bones, which are remnants of the separate ossification centers which have not fused. How the occipital bone forms has probably continued to be important even in recent human evolution. So for example, if one were to compare the skulls of most members of early Homo species, notice that the skull is low and long. We often focus on the forehead, but also notice that the occipital region projects. There's what's known as an occipital bun. So our human species developed a new type of skull, which is higher and more domed, but also which is shorter in the anterior to posterior dimension. There's a shorter occipital region that may have had implications on the structure of our brain and the ease of childbirth and other features of our species.